Welcome to This Week in Health events, where we amplify great thinking with interviews from the floor. Although we aren't getting as many steps in this week, we're still going to continue doing the interviews. Special thanks to our channel sponsors, Starbridge Advisors, Health Lyrics, Galen Healthcare, VMware, and ProTalent Advisors for choosing to invest in our show. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. You know, a lot of healthcare happens between visits to care settings, and that is what we're going to talk about today with Summer Knight, Managing Director in Deloitte Consulting's Life Sciences and Healthcare practice, where she leads the virtual health product portfolio, as well as virtual health platform enablement practice for the firm. As only a consulting firm can do, your titles are amazing. Good morning, Summer, and welcome to the show.
Good morning, Bill. Thanks for having me. And I think you can get your steps in. You just have to be outside in nature a little bit more.
Well, give us some background on your practice at Deloitte, and we'll start there before we dive into virtual health.
Yeah, absolutely. So have been just really enjoying all of the efforts that our team does at Deloitte. We our virtual health product platform, and what we do is that we have a comprehensive approach to virtual health and helping our clients be able to set up a virtual healthcare system. And what does that mean? That means being able to bring technologies, both ConvergeHEALTH virtual technologies, which is the Deloitte technology products, as well as our alliance partnerships, to bring a comprehensive best-in-class solution to our clients to really help them to enable virtual health as part of their care delivery transformation to meet their business needs.
Well, back in 2011, I actually did a 5-year strategy for our health system, and actually Deloitte was a part of shaping that. And we talked about doing more outside the 4 walls of the traditional hospital setting, and we wanted to do that with a totally different capital structure. And a lot of health systems have expanded into retail, but the promise of digital has always been to be able to do that, again, to increase the number of touch points between visits and really the informed care team to do a lot of things, right? To improve outcomes, to increase awareness, to just generally improve the quality of health in the community. We were talking about that back in 2011, and but things have really progressed since 2011 in this space. Give us an idea of where we've come, maybe over the last 5 years in this virtual health practice. Things that are maybe on the cusp or accepted today that we can actually do, versus things maybe 5 years ago that we were saying it would be really nice if we could do more of this.
Yeah, and when framing that question, oftentimes I might be in a mixture of folks who are clinicians like myself and technology experts like yourself. So oftentimes I'll say, we were joking about this before we even went online, is with a group of clinicians, I'm very tech savvy, and with a group of technologists, I'm very clinical savvy. So one of the things to just kind of set the stage is to think about digital health in 3 areas that we're hearing quite a bit in the health IT space. So we hear about, and then also to determine what is hype and what's actually happening. So we hear quite a bit about integration and data. We're hearing about analytics, and we're hearing about virtual health. And I think about that as the 3 main pillars, at least in my world, around digital health. And from the perspective of what organizations have been focusing on, I think you'll agree that it's been a lot around integration and how to manage and move data around. And then in that second pillar, and we've seen a lot of activity in that space and a lot of progress. And then in the second leg of that stool, the analytics. So we're beginning to, now that we have better control over that data, beginning to learn how do we take that information and make it actionable through our analytics, AI, and ML. And then that's an area that can really improve the information action, not just for clinicians like myself, but also for healthcare consumers, and help us to reach people just in time, or at a moment where they're making a decision, or at a moment when they're ready to make change in their lives, which can be correlated to a major health impact, unfortunately, happening to them. And then third, we've heard a lot of hype, but not as much action in the virtual health space. I think we're right on that tipping point from a predominantly bricks and mortar situation that's also has been challenging from a reimbursement perspective, to actually having this mixed virtual and in-person experience for the healthcare system.
What keeps the reimbursement from really leading the way? What keeps because if the funding's there, virtual is going to explode, is what I believe. I mean, is that?
I agree.
So what's keeping that from happening?
Well, I think there's a lot of levers. So in the model that makes sense is when the provider, the clinical teams, and when I talk about clinical teams and virtual, there is a significant re-engineering of those teams, which we can hit on in just a few minutes. Yeah. But they need to be able to work in an ecosystem where they have the capability of choosing whether virtual health interaction versus an bricks and mortar interaction is the most appropriate to best serve that patient and best serve the situation at hand. Currently, the majority of our reimbursement model is such that in order for that clinician or that clinical team to be paid for the visit, or to be paid at an amount that makes sense for them to be managing the business financially, it has to be in the bricks and mortar. There are some provisions that allow care to occur virtually, and there's been some wonderful movement in that over the past couple of years. We've seen rural virtual care reimbursements on a national level. We've seen indicators for remote patient monitoring. That's when a patient will have a device that then that biometric information feeds into a system. So we've seen some movement there, and we've seen some movement definitely in situations where the clinical team is part of the risk of managing a patient's overall life. And so that's often referred to as risk-based agreements, and can be seen in bundles and in other types of patient medical home opportunities.
So Summer, so the first roadblock we get to is financial. The second roadblock we get to is this reengineering you're talking about. There's a significant cultural change, and what have you seen in terms of organizations that have been able to make that change, and what are they doing?
Yeah, it is a huge cultural change. So one of the things that I think many people think about is the technology. Can the technology work? And the technology has really been around for a while. I mean, think about, we've been having video conferences for quite some time. We've been passing data over the internet for quite some time. And so, I always like to say technology is there. Maybe the analytics are still growing. The new cutting edge, technology is moving so fast that we are going to be doing it better and better, faster, and with better outcomes. But when we make these shifts into integrating virtual health into care, there's so much more. And culture is a huge piece of that. Also, there's workforce change. And so when I think about virtual health, I think about really a comprehensive, continuous therapeutic alliance that we're able to create between the health team and the home team. I think about the home team as the healthcare consumers, so the patient, and their natural support network of family, friends, and volunteers. So that really extends the definition of who that healthcare consumer is. And then the health team is actually, in the past, has been built on built around a physician, so say for myself, and then an entire team wrapped around that with nurses, nutritionists, exercise physiologists, case managers, et cetera. In this new world, we're going to be testing new models around that, around what that health team looks like, and really who is the quarterback, I guess, for better word, of that team. Will that right now we think about that quarterback as being the physician, but as we move to caring for more and more people on a population-based level, and we also struggle with the number of clinicians that we might have in ratio to patients, we have to start to think about using this technology to be able to move people to the top of their licenses and also rethink the team. So in the future, it may be that the care coordinator and the care manager are really the middle of the team, and then they pull in a physician and they pull in the nurses and the nutritionists as that patient needs. And who knows, maybe based on as we help move the control of the healthcare more and more towards the consumer, maybe that consumer will start to be able to take more of an integral role, really definitely in that health and wellness space, where we're seeing people who are interested in moving into that space. And then as we're able to meet people in their chronic conditions and really help to educate them and nudge them, they can even take a more active role and a leading role in those situations as well. So it'd be really interesting to see how this whole health team, home team integrates as we leverage all these technologies. So big cultural changes in the future that will be interesting to see how they unravel and how they evolve, and how roles such as mine as a physician will be part of their lives. But hopefully we'll continue to create this therapeutic alliance, which is built on a continuous longitudinal connectivity, built on trust and optimizing healthfulness, even when somebody is impacted by a chronic condition.
Health team and home team. I'm going to take that. I'm going to steal that. I'll give you credit every now and then.
It's yours.
That integration is interesting, but I want to get to the last roadblock, and it's me, right? So it's the consumer of health is the last roadblock, and I want to give you permission to talk a little bit about some of the tools that you guys have. You need to engage me. You need to keep me from eating at McDonald's. You need to get me up and moving. You need to get me, when I'm potentially sick, instead of going into work, interacting with my care team virtually. So what are we going to do to engage me, the consumer of health?
Yeah. So, right now, the majority of folks will run to with the cliche of Dr. Google. So don't be offended, Google fans. I love Google. But we'll run and get information, and or talk with neighbors and friends. And that information can be fraught with misinformation. And so what we really want is for the healthcare consumer to have the best, most accurate information that really works for their situation and their constellation of disease situations, genetics, past history, family history, et cetera. So really more of a precision medicine perspective. And to do that, we really need to create, and this is where I was talking about that therapeutic alliance. And that's where I think technology can be so powerful. And all of the learnings that we have from consumerism and consumer marketing and apps and how people interact with their phones and their tablets. And so what we've created is really this new perspective on a virtual healthcare system, where what would it look like if we didn't have the bricks and mortar, except in very specific times, such as specific types of surgeries and in areas of care that required bricks and mortar centers of excellence. And then if we did that and we built that system around the healthcare consumer, as we previously defined, and creating a continuous longitudinal relationship, that would mean that at all times that we are actually moving through that individual's life. Because remember, right now in the current transactional healthcare space, we get to see a patient if they're healthy, maybe a few minutes of their entire year if we're lucky. If they have a chronic condition, maybe 4 times a year. So it's very hard to impact them. But if we're with them all the time with technology, such as solutions that we've built called MyPath for Connected Care, which is a solution that's built on a hub that is integrated with the patient's smartphone, it's integrated with their records, it's integrated with other systems that they might want to connect with, such as Amazon, and then being able to move through that with that connection. As they have needs, they can communicate with their health team, and then we can also communicate with them through nudges. And therefore, when they have a question about their chronic condition, they can turn to that connection through their application, through other omni-channel capabilities, and being able to turn to their health system, let's say brand, on a regular basis and get their needs met, which is very different than what they're able to do at this point when they have to call, wait for someone to call back, make an appointment, sit in a waiting room, etc.
Absolutely. And it's, as you're talking about, I sort of want to go into a big brainstorming session on what we should do here, but because it's interesting to me with the final rule coming through, I think you're going to start seeing patient-centric, consumer health-centric data stores. Those data stores are going to have more access to data, right? So I'm able to bring in all my Amazon purchases, all my Google search history, all my fill in the blank, my swipe card at Ralph's grocery store, whatever. So I'm able to bring all that data in. And when you talk about a virtual health system, I'm almost thinking, there's now this potential for either existing health systems to play this role or new entrants to play this role, where I give them all my data. They are able to go through all that and say, look, we're gonna help you with the behavioral change that you need, because that's what I need. I need behavioral change. I need to walk more. I need to exercise more. I need to eat less. I need to hike more. Whatever. I need to do a whole host of things. Yeah. And I think that data
85 to 90%. Yeah, 85 to 90% of your health has to do with the choices that you're making. That's correct.
So how are you going to integrate, this is my last question, by the way, because we're already 3 minutes over. I apologize. But my last question is, how are we going to, because there's really powerful stuff around behavioral change. And are we going to start integrating that stuff into these digital tools where it's actually looking at our persona, a deep look into our persona, and recognizing what causes me to change versus what causes you to change?
Yes, we are. And that's actually, a lot of people ask me why I'm so proud to be part of the Deloitte team. And part of that is because as a convener, we know that we don't have all the answers. Believe it or not, there's a lot of so many amazing people and experts in the firm. But also what we have created is an amazing network of alliance partners. And that gives us the capability, using our virtual healthcare system hub, to be able to work with some of these best-in-class alliance partners. And they can be anywhere from big tech all the way through brand new startups that are just starting to leverage cutting-edge technology in order to bring some of those best-in-class solutioning. And you gave a great example. There's some really amazing behavioral health, precision health solutions leveraging AI that can really change that conversation that we're having in healthcare by pulling in that data and then advising. And those systems get smarter and smarter. And so being able to integrate that into our solution in order to offer our clients a comprehensive offering that really benefits that healthcare consumer and helps that healthcare consumer become part of the solution, and therefore decreasing their risks around health and improving their outcomes. really is the winning structure. So I think if, as you said, we're rounding up our conversation, I would say that that anyone at Deloitte would say that it's that we are part of a solution with an ecosystem of partners, with our clients, with our alliance partners, to really help solve this problem together. And so, to make the lives of healthcare consumers and healthcare clinicians just so much better as we evolve to this future of health. So really excited to be part of that, and excited to be talking to you as well, Bill, about all that's possible.
Yeah, this is exciting stuff. Thanks, Summer, for coming on the show. Is there any way people could get more information on this stuff you're talking about here?
Yeah, absolutely. So, so on our Deloitte website, we have ConvergeHEALTH, which is a really great way to look up information. We also have some blogs that I've been putting out, and we're going to see a big increase in that from a virtual health perspective, rolling out as well. So connect on LinkedIn, and I'm also going to do a shameless plug, is that we're publishing a book called Humanizing Healthcare. Of what I worked on is my own experience in the healthcare system with one of my dear family members, and how we navigated that, and how it really impacted my life in a way that shifted all of my activities, and actually landed me here around trying to do care delivery transformation. So that's called Humanizing Healthcare. So look for that coming out as well. Hopefully this experience was good for you, because I'd love to interview you after the book comes out and just talk through the book. That would be great.
If you're up for that, that would be great.
It would be such an honor. Thank you so much.
Don't forget to check back multiple times this week. We're dropping a bunch of HIMSS episodes. We're not walking the floor, but we are interviewing a bunch of people. So please check back. This show's a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com, or the YouTube channel. Thanks for listening. That's all for now.